right, I'm hoping we are now live.
Yeah, it says we're live streaming.
Okay, very good. All right, then let's go ahead and get started.
Okay.
Let me share my screen one more time and we'll get started. Do you still see my screen?
I see you.
You see me. Let me share my screen one more time. Okay. All right, everybody, welcome to the first PA Lyme virtual series event. We're all in the same boat here. We're all in support groups across the state, and this is the second month now that we're not able to meet in person. So we hatched this idea that we would, with the technology that we have, start this virtual series statewide, get some very good, fantastic speakers to speak to the whole group, and we're glad you're here. Hello to my group in Pittsburgh. Hello to everybody else that's out there. The first series that we're having, or the first session that we're having, is Living with Lyme Disease in the Coronavirus World, and we're very excited to have Dr. Chris Turnpaugh with us tonight. And hello. Bear with me, my screen will not advance, of course. You know, technology just does not work when you want it to. There we go. Okay. So my name is Bill Moore, and I am board member, director of IT for PA Lyme Resource Network, and I am the regional leader of the Pittsburgh Lyme Disease Support Group. So just a couple of things before we get started with Dr. Turnpaugh. It is tick season. I know everybody is fixated on COVID-19, the coronavirus. Everybody is fixated on avoiding that, as well you should. However, there's another risk out there. People are spending more time at home, more time in their backyards. You want to be worried about ticks. The ticks have become active now. Both the adult ticks and the nymph ticks are active. So be careful. We have, PA Lyme has the Dare to be Tick Aware program. Unfortunately, this would be the time of year we'd be having a ton of our seminars, and we've had to cancel most of them, or all of them, I should say. We're about to go with a virtual option for the Dare to be Tick Aware program. We're going to have a pre-recorded video for Dare to be Tick Aware any day now on our website, palyme.org, for a small donation. You can either view an individual version, or if you want to have your own Zoom meeting or webinar with a group, there's a version for that as well. So I want to remind you about the Dare to be Tick Aware program. Visit our website, and there's more information about Dare to be Tick Aware, tick prevention tips. But be careful out there. If you're going outside, spending more time outside, beware of the risks. Wear your repellent, treat your clothes with permethrin, basic tips like that. Remember that we have free tick testing in Pennsylvania, which is great, through www.ticklab.org, which is East Stroudsburg University. So remember that if you do get a tick, if you're unfortunate enough to get a tick bite, you can get your tick tested, and tick testing is 99.9% accurate, whereas testing yourself for Lyme disease is extremely inaccurate. So getting the tick tested is a lot easier than testing yourself. So for tonight, just a couple of ground rules about how things are going to work tonight. If you want to ask questions, please use the Q&A option in Zoom. If you're on Facebook, leave comments. I will try to monitor to the best of my ability. I will try to monitor both the Q&A section in Zoom as well as comments in Facebook. I will try to provide Dr. Turnpaugh with the most relevant questions that are out there. And I apologize ahead of time if I can't get to your question. But I think that's all I want to say at this time. So once again, we're very excited to have Dr. Turnpaugh with us tonight. He's a friend to the Lyme community, does a lot of good for the Lyme community, treats a lot of Lyme patients, has a lot of experience treating Lyme. He is with the Turnpaugh Health and Wellness Center in Mechanicsburg, and he does have a lot of experience in supporting patients dealing with the most difficult chronic autoimmune and neurological conditions. Of course, Lyme disease is definitely one of those conditions, as well as other, he treats other autoimmune conditions and thyroid disease and hormonal and neurological conditions. So Dr. Turnpaugh, welcome, and thank you very much for being with us tonight.
Well, it's a pleasure to be here. I'm honored to be the inaugural Get the Kinks Out speaker for the virtual online PA Lyme support. All right, you want me to share my screen?
Yeah, go ahead and share your screen at this time, yeah.
Okay, can you see my screen okay, Bill?
Yes, I see your screen, yes.
So tonight I was asked to kind of present living with Lyme disease in a coronavirus world. And it was interesting, just about this time, I had a very good friend and colleague who's an immunologist who wrote a research paper on coronavirus and how to deal with coronavirus potentially, some good research-based approaches, and it was published, which means it's now indexed and it's in the scientific literature. One of the parallels that I drew from reading the paper was it's very similar, has a lot of similarities, I should say, with Lyme disease. And I think that, as was mentioned earlier, so many of us have focused on the coronavirus, and we have failed to keep focus on Lyme disease. Not those of us in the Lyme disease community, but the rest of specifically we'll talk about PA, has seemed to have lost focus on some other of these debilitating illnesses, such as Lyme disease. So I wanted to go through some ways to address and manage maybe your immune system, which would be beneficial for coronavirus as well as Lyme disease. So it's interesting that as we talk, we say coronavirus is the elephant in the room, but I think for many of us in the Lyme community, now there's two elephants in the room. It's not just the coronavirus, but it's those of us with Lyme disease or those that have had Lyme disease as well. So it's important to keep both of them on our forebrain, and what can we do, what steps, what measures can we take which are beneficial. So I'll go through some research. I'll try and keep it very superficial in the beginning. We'll go a little bit deeper into the research and come back out with some management strategies that may be beneficial. In addition, I'm used to lecturing with a room full of people, so this is the first time I've given a lecture with no interaction like this. So please feel free to type your questions in, ask your questions. Want to make sure we're keeping it on topic for the community at large as well. So hopefully we'll walk away with some really good strategies to support ourselves, whether we want to just keep ourselves healthy, or how do we maximize our immune system once we've been exposed to Lyme disease and try to suppress the flare-ups that can come with Lyme disease. So that's kind of the introduction. I know, I believe the next one is Dr. Burrascano. Is that correct, Bill? The next one is Joe Burrascano.
Yeah, that is correct. Okay. So 2 weeks from today, we'll have Dr. Burrascano. That's true.
Yeah.
That's correct.
So, and he's the kind of the grandfather of the Lyme research community. So I'm going to kind of be talking about what we can do, and he'll probably go into a deeper dive on some of the topics. So living with Lyme disease. So this is the paper that was published very recently by Dr. Yannick, very well credentialed paper and authors. And I'm going to reference that throughout the presentation, but I want to start off with something very simple. I was talking to Eric Huck, who's very involved in the Lyme community, and I was talking about this principle. Very simple. It's called the hand of health. We use it in the office all the time. If you can picture your hand, you can picture a model of health. So if you just put your hand in front of you, as you see there, and we'll go through each finger. So the pinky finger at the bottom is how and when you eat. Your ring finger is how and when you sleep. Your middle finger is how and when you move. Those are the three foundations for all of us, regardless of what our health conditions are. That's the starting point for all of us. The index finger is what supplements you can use to support yourself. And then the thumb is the medications that you would require that are needed during certain times. And I think many times we focus too much on the thumb and not enough on the other fingers. So how and when you, and I'm going to go through these piece by piece. So how and when you eat is not just the type of food you eat. We know things such as sugars or inflammatory foods can set off an inflammatory cascade, which has been talked about with the COVID virus. It's called the cytokine storm or inflammatory cytokines, but that is familiar to all of us in the Lyme community as well. So when we eat the wrong foods, we can trigger what appears to be a Lyme flare-up because of the fact that it drives inflammation. And then also, there's a lot of talk recently on intermittent fasting, time-restricted feeding, periods of fasting, which allow your digestive system to calm down and your immune system can focus on other issues. So it's not just what you eat, it's when you eat. The ring finger is how and when you sleep. So sleep can lower natural killer cells significantly. Even with as little as 6.5 hours of sleep can reduce your immune system function. Some of these cells I mentioned are actually measured in many Lyme cases. When we look at CD57 counts and different cell counts we do on blood tests, we sometimes look for either a medication or even a supplement, and we fail to recognize how important things like diet and sleep are. And sleep's very important. So sleep it's not just when you sleep or how many hours of sleep you get, it's how many hours of deep sleep you get, how many hours of REM sleep you get, hours of sleep before midnight. We see an awful lot of patients with Lyme disease that suffer from insomnia and have very difficult time sleeping. So it's hours of sleep that you get and hours of sleep before midnight. It's important. So how and when you sleep, how and when you move is important as well. So many people with chronic illness, such as Lyme, suffer from extreme fatigue. And in the healthcare world, many are told, oh, just exercise, get back in shape, move. And it's not easy to move. So how and when you move is as much what you can do and how you're exercising. Then many of us will go out and overtrain and work too hard, and we kind of break down and crash. So it's moving with respect to what your body can do. Now, how and when you move also should incorporate not moving and self-reflection and prayer, meditation, whatever you do to take personal inventory to calm yourself down. In Dr. Horowitz's clinic now, it's an integral part of what he does. We do it in this office too. We have a full-time therapist, which we decided to hire for the purpose mostly of what Lyme disease can do to our mental state. So how and when you move is being and taking inventory of how you're feeling and what's going on. So those three are paramount, and they're our foundations. And from our foundations, then we say, well, what do I need to supplement to support my body's function for the sleep, the movement, and the eating? So that's how, and that's our supplementation. And then last, which I like to remove, it's conveniently disassociated with the other four fingers, is the drugs and the medications, which are so often required for Lyme disease patients, but many times, in our opinion, are almost overutilized. so that we focus on killing the bug and not the health of the host. And that kind of ties into the COVID virus quite nicely, because the people that are the most severe from COVID are the ones that have comorbidities, the ones that have other problems with their immune system. And so it's important to keep our foundations extremely healthy so that we don't have a significant effect of the COVID. Well, that is also true of Lyme disease. It's the health of the host once you were bit by the tick. So how healthy were you when you got the disease will help to determine how well you come out of this disease or resolve this disease or put it into remission. So I think that's important. When we see patients come in on 11 antibiotics and 75 supplements and their diet isn't really managed, then that's not a prescription for resolution of the flare. That's just kind of beating and beating and beating. And again, personally, I just came off a course of disulfiram, so I understand that the medications are absolutely required at times. However, I think it's important to support the pinky ring and middle finger as our foundations of health. So, and then we'll get into a little bit more of a deeper dive on that. So
Dr.
this is
Turnpaugh,
yes.
we have a question I think is relevant. Can I ask
Sure.
it real quick?
Sure.
It's if one gets 8 hours of sleep starting at 1 a.m., is that as good as if you get 8 hours of sleep from 10 p.m. to 6 a.m.?
No. So one of the questions we'll ask is hours of sleep before midnight. It's important. It's hours of sleep before midnight. And if we really kind of break it down differently, it's, are you sleeping when the sun is down? So we know, for example, third shift workers have a disproportionately high amount of immune dysregulation. So if we could tie our sleep to, or our circadian rhythm to sun going up, sun going down, it's not the same just to say, I got 8 hours of sleep. It's hours of sleep and when you got them. It's also important, maybe I could parlay that into this comment, is you can never make up sleep. So if you have 5 hours of sleep one night, you can't get the extra 3 the next night, and it carries what we call a 3-day blast radius. So poor sleep one night carries a 3-day immunological effect. So no, it's not the same. Now, that being said, sleep hygiene is very important. So when you go to sleep, if it's consistent, it's beneficial. But it's a great question. A lot of people think they can make up sleep by going to bed at 3 a.m. and getting their 8 hours in. That's not what the body's asking for. The body's asking to go to sleep when the sun is down. So good question.
Okay, thank you.
So this is a picture that we use regularly in the office, and I didn't do it to try to be fancy, but here at the very top, generically, we have what's called an antigen presenting cell. And the reason I think this is important is because this is something that's being presented to the immune system. It could be COVID-19, it could be Lyme disease. Down in the lower right, we see food. Food is a very large part of the antigen. And we'll see that these substances that are presented to the immune system can go down to what's called the naive T cell. Now, that naive T cell has to grow up and become a different type of a cell. And so we'll see here Th1, T regulatory cell, Th2, Th17, Th9, Th22, Th follicular. These cells are what the naive T cell matures into and becomes. And it's very important because this is how effective we can fight off certain pathogens. It's also important to mention at this point that something that can dysregulate this is stress, poor sleep, fight with a spouse, poor diet. And you see down at the bottom here, the very bottom 4, we see heart disease, mood disorder, digestive issues, addiction, autoimmune disease, and cancer. Now, these are some of the sequelae of the immune system being under a chronic attack, chronic inflammation. We see there are diseases associated with Lyme disease that include heart disease, mood disorder, digestive issues, addiction, autoimmune disease, and cancer. So our good colleague, Dr. Spector down at Duke University, if any of you have not checked out his book, Gone in a Heartbeat, fabulous book about how he's a world-class oncologist at Duke University. And the long and the short of it is he had tick-borne illness and was told by his colleagues, you're lazy, you're tired, all this kind of stuff. And the reality is he needed a heart transplant due to his infection. So if we have cardiomyopathy secondary to Lyme disease, this is the model that explains it. Certainly, we've already touched on mood disorders that are associated with Lyme disease. Digestive disorders are ubiquitous. Autoimmune disease secondary to Lyme disease is extremely common. And as I mentioned, our colleague at Duke, he has found that over 80% of people with breast cancer have Babesia. So, or I mean Bartonella. So they're infected with Bartonella. Now that doesn't mean that correlation is not causation, but it's pretty suspicious when 80% of the people with breast cancer on a biopsy find Bartonella. So much of the conversation will focus around this type of a picture. So I blew it up a little bit and for simplistic reasons. And I want you to notice here on the left side, we see Th1, and Th1 interacts with natural killer cells. And this is one of the way your body fights infection. Now, if you look underneath Th1, I don't know if I can, if you look underneath Th1, you'll see Th1 kind of blocks Th2, and Th2 feeds Th17. Th2 and Th17 will fight or stimulate these cytokines, which we've heard a lot about with the COVID virus, is this cytokine storm. Well, it happens an awful lot with Lyme disease as well. So Th1 is very important to keep robust, keep healthy, to be able to fight off whatever comes down the pike, anything small, a virus, a spirochete. And so again, this is the side of the immune system we tend to try to measure with chronic disease and illness. This is where we get like our natural killer cells, our CD57 cells. So those of you that are familiar with this count, this is a natural killer cell count. If that's low, it's not indicative of Lyme disease. It's indicative of your immune system not functioning correctly. And that's a bigger problem because it doesn't mean we have Lyme disease. It means we don't have the ability to fight Lyme disease or anything else that comes in. And this ties into COVID because if we're suffering from Lyme disease with immune dysregulation and we get COVID, we're more likely to get these inflammatory cytokines and have more of a negative output. So hopefully that makes sense to some of you and you follow it. This is the picture that I would love for every single clinician to comprehend as well as every single patient, because a lot of what we want to do is support your immune system so that you can work your way out of your flare-ups from Lyme disease or any other chronic illness. So there's just the blow up again. So this is the paper, again, we're going to reference. In the reference, we talk about prevention, infection, escalating inflammation, and recovery. Now, this is with regard to COVID, and it's very well documented and researched. It's in the literature. But we see here recovery is support is focused on resolving inflammation, inhibiting fibrosis and other forms of tissue damage, curtailing losses of function, and restoring and reoptimizing function, because patients have been observed to relapse into escalating inflammatory phase. It is essential for the clinical surveillance to continue well into what may appear to be recovery phase. Now, you could take off COVID-19 right here and replace it with Lyme disease. Does that sound familiar to a lot of our listeners? That, we really want to clinically address how this is progressing, and it may continue into the recovery phase. And in the recovery phase, we can relapse from a lot of our Lyme symptoms. We'll talk about this. This is an important picture, which just has simple things that many of us have done, but we see there's prevention, infection, escalating inflammation, and resolution, and some things we can do on the left, which I think we could focus and should focus on. A very top there, we see address sleep and stress and diet. So even in the paper, it goes with my simplistic hand of health: sleep, stress, and diet, and movement. That's our foundation. And that foundation is so important for everything that falls below. Certainly, we want to do things like antioxidant support, natural killer cells, Th1 support, and then support inflammation. So I want to kind of progress through this and see what kind of questions specifically people have and how they can support themselves going forward. So we want to determine determine a proper clinical targets and strategies. This is a key factor. We put a little video out on this a little bit ago. What this basically states in the paper is that your level of inflammation at the time of any infection, so we could, again, replace COVID with Lyme disease. If your inflammatory status is high when you get the infection, you're less likely to have a good outcome. Now, here we use patient's fatality risk and threshold, but you can say level of symptomatic behavior or disease state. So the level of inflammation prior to infection is critical. It is tick season. Ticks are out there. We don't want to be in a high inflammatory state when we get an infection. And many of us have heard, oh, I got Lyme disease and I took 3 weeks of doxycycline and I haven't had a problem since. The difference wasn't the strength of the Lyme disease per se. It may have been the health of the host when they got bit. Such a crucial and important point. And these brings to light the comorbidity factors that we're having with the COVID-19 and the coronavirus. A lot of it is based upon those people that are at risk were the ones that weren't the healthiest to begin with. So I think we need to take a preemptive strike at being healthy before we get any of these tick-borne illnesses or even COVID. So the 4 phases we want to focus on are prevention of infection, escalating inflammation, and recovery. So these are the 5 steps. We have 5 steps to go through. Taken together, the 5 targets of support represent a strategy that can be deployed across the 4 phases in a time course of the patient's illness. I want people to be able to overlay what everybody is saying about COVID because it's taken center stage, and parlay that and transfer that over to Lyme disease because it's a very similar approach. It's just never gotten the press that this COVID has gotten. So the first one is our foundational support against sleep. We talk about the Th1 and Th2 part again, that seesaw, if you will. So healthy sleep promotes Th1 or T helper 1 cell response. Th1 cells secrete interferon gamma. Interferon gamma supports antiviral response. It supports anti-Lyme response as well. So sleep absolutely has a direct effect on our immune system. Disorders of sleep promote inflammation and a Th2 response at the expense of being able to fight off the tick-borne illness or the COVID. Stress chemistry is inherently inflammatory, so stress and poor sleep go together. We see so many patients who have been under chronic stress as well as poor sleep when they get tick-borne illness. Glycemic control is a fancy way to say diet. Insulin resistance, obesity, and impaired glucose tolerance have all been shown to be associated with inflammation. So we need to get our foundation in order and not just rely on a magical cure. We need to get our foundation in order because these are in the Lyme or tick-borne world, these are issues we're going to be dealing with for life. So our foundational support. So eliminating factors that can drive what's called non-purposeful inflammation. So it's important to also recognize that if you twist your ankle and your ankle swells up, that is purposeful inflammation. But non-purposeful inflammation comes from things such as a poor diet, a diet that is associated with inflammation, a highly refined diet, a high sugar diet. These are factors that will drive inflammation and will drive us away from immune balance. We've heard so much about the microbiome and the healthy gut flora, probiotics and things of that nature, which are super important at maintaining the balance in our immune system. And then if we talk about the hand of health, the middle finger is exercise. Physical activity has long been known to be a critical for proper function of virtually all physiological systems. However, to decrease inflammation, the right intensity is critical, with moderate levels affecting at lower inflammatory markers. So you don't want to be too intense with your exercise. People that go out and try and overcome and push through when they're sick with things like Lyme disease or COVID, it's going to drive too much inflammation, and that's inflammation our body cannot handle. So sleep, super important. Stress. Super important. And are we under more stress when we're all under quarantine, can't get out, can't have our social lives back? So COVID is driving us towards a state which would increase the probability of a Lyme flare. And our diet is very important as well. Exercise is important in moderation. Know what your body can handle. Know the level that you can do. Sometimes if you say it hurts too bad to exercise, exercise is not the best for you. No exercise and inactivity is not good for us. And it's important to also recognize the stigma of, oh, you're not exercising. Maybe my body can't handle all the exercise you guys want me to have. So again, we come back to now, what else can we do? We've addressed the importance of sleep, stress, diet. What is foundational? I had a patient once come to me with tick-borne illness, and he said he was $150,000 into his care. And he'd gone to some great professionals and taken a lot of medication. And his vitamin D level, which should be 80, never below 50 with Lyme disease, in my opinion, was at 13. That's a $10 test. So I think it's incredibly important to know some of our supportive foundational states. And we're going to dive into that. So we talk about the foundational support, supporting levels of vitamins and minerals with known immunological roles, and identifying the risk factors that represent increased risk of a patient entering inflammation. Now, the paper is talking about COVID, but just identification of risk factors that represent increased risk of escalating inflammation. Escalating inflammation is what most of us in the Lyme world have gone through, and so we want to reduce that. Patients in this category are likely candidates for natural killer cell and Th1 support at a baseline, meaning if we have a risk factor for escalating inflammation, we don't have that side of our immune system, that natural killer cell side and the Th1 side. So natural killer cell support. So natural killer cells drive the core immunological response to a viral as well as a spirochete infection. The diversity of natural killer cell types and the role in healthy and diseased lungs have been reviewed. We talk about lungs because lungs are affected in COVID, but it's their overall immunological relevance and coordination with Th1 cells as antiviral, anti-spirochete, tick-borne illness immune responses are discussed. Th1 support. Th1 plays a key role in antiviral immunity. Th1 cells and natural killer cells support each other. So in that picture, if we remember the Th1 and the natural killer cells work together, if we could think of Th1 as, again, our CD57 cells that we measure so often to see how the immune system is doing. And in a study of COVID-19 patients, the total number of natural killer cells has shown to be markedly decreased. And yet it's the same marker we look at in tick-borne illness. We're looking at tick-borne illness, and one of the measures we see to see how we're doing is this CD57 or natural killer cell markers. It was just shocking to me, the correlation that was played between COVID and tick-borne illness. Importantly, natural killer cell and CD8 cell numbers and function rebound during patient recovery. And what do we use CD57 marker as? How well we're rebounding from the tick-borne illness. Th2 dominance patterns can thwart the attempt to support Th1 response. So many factors common in chronic illness can drive the patient into a Th2 dominance, including stress chemistry, sleep disruption, asthma, GI inflammation, among others. Asthma patients are known to be predominantly Th2. Tick-borne and Lyme disease patients are predominantly Th2 dominant. Diminished, we talk a lot now, and we use this an awful lot with patients' support for Lyme disease. Diminished glutathione levels and status is associated with the loss of interferon gamma, which shifts us away from Th1 and towards Th2. This is especially concerning in light of the reinforcement roles of what's called reactive oxygen species or oxidative stress, inflammation, fibrosis, depletion of glutathione in the lung helps with loss of anti-inflammatory protection in the lungs. This is all concurrent with Lyme disease. Lastly, animal corona models have shown that mast cell residual or residing in the respiratory submucosa may play a mixed role, including the generation of a Th2 pro-inflammatory cytokine. What does all that mean? The reason I put this slide in here is how many of us have suffered with tick-borne illness, which has migrated into what's called mast cell activation, which is a new buzzword, mast cell activation. The mast cell activation, or this chronic inflammatory state, hives, inflammation, chronic pain, peripheral neuropathy, all the things that we may associate with chronic inflammation, we see in many, many, many chronic tick-borne illness patients. And the mechanism, which we harp on here, the mechanism of that mast cell activation is likely a Th2 pro-inflammatory cytokine influence. So it's important to look at this. And then something as simple as quercetin has been shown in many human studies to quiet this down. So here, just as a refresher, we talk through this. Usually in a live lecture, I would have this slide up for people to reference as I go through it. But we see over here to the left again, the Th1 natural killer cell is so important to maintain a healthy response during a Lyme disease flare-up or a viral flare-up, and hopefully never a Lyme disease combined with a COVID-19 flare-up. That's a key point. We don't want to have both at the same time. So what are anti-inflammatory supports? So key targets that can inhibit inflammation of these fancy cytokines. Well, glutathione and N-acetylcysteine, which I'm sure many people have heard of. These are important roles for antioxidant support in COVID-19. Again, you could replace COVID-19 with tick-borne illness. Glutathione and N-acetylcysteine are both components of normal human biology. Glutathione appears to play a key role in both immune surveillance, which is so important when we have immune surveillance. That means we have kind of a roaming army around to attack our tick-borne illness or COVID-19 when it decides to flare up again. We see here glutathione promotes natural killer cells and inhibiting macrophage function. NAC, oral NAC, is readily absorbed by the stomach and the gut, and it converts through the first pass in the metabolism. The majority of cysteine is secondarily incorporated into glutathione and released into our system. So here's another slide from the paper. We see GSH stands for glutathione. NAC is N-acetylcysteine, which converts over to glutathione, which inhibits inflammation in our lungs and reactive oxygen species, which inhibits excessive thrombosis. And thrombosis is something we're seeing in COVID, but as Dr. Holtorf has talked extensively about as well, we see in these tick-borne illness patients this thickening of the blood, which is a phenomenon that many people overlook. So we're running many of the blood, for lack of a better term, blood thickening profiles on our tick-borne illness patients and seeing they're excessively high. That's driven by reactive oxygen species, can be helped to be downregulated by something as simple as glutathione and N-acetylcysteine. Also, we see here mast cell activation. So we see our T cell and natural killer cells. What do they do? Well, they help to facilitate immune tolerance, inflammation, mast cell activation. So we need our natural killer cells to function to reduce this inflammatory cascade as well. I just put this one slide in here. I'm not a product peddler by any stretch, but Trifortify Orange by Research Nutritionals is considered the gold standard of liposomal glutathione, which I know Dr. Berescano may touch on next session. He's a huge fan of it. So one of the things we check every patient for, as I said, a patient came in, spent a bunch of money and never had their vitamin D level checked. Vitamin D is critical. Every single one of us should know our vitamin D level at some point and should have it monitored at least twice a year, once in the summertime and once in the wintertime. It's a simple test. It's not an expensive test anymore. And for those with chronic illness, autoimmune disease, recurring illnesses, my opinion is our levels should be at 80 and should never be below 50. Now, labs will put this level at 30 is the cutoff, but we see optimal function above 50. There's so many research papers out there that have studied Venezuelan and Australian lifeguards who are healthy, and they routinely check their levels, and their levels almost always come back around 80. Some push the levels a little bit higher, some a little bit lower. In this paper, it's referenced the goal-bringing lab ranges between 40 and 60. I would say 80 is probably the best for anybody who has already known autoimmune or tick-borne illness. Many studies have shown that vitamin D deficiency not only impairs immune function, but also promotes excessive inflammatory reactions. Vitamin D has been shown in so many patients to help their sleep, their stress. It's been shown in many patients with postpartum depression, mood disorder to be helpful as well. So deficiency has been shown in many inflammatory and autoimmune diseases such as asthma, arthritis, multiple sclerosis, diabetes. Many of these diseases are secondary to Lyme, in my opinion. Vitamin D plays a role both in immune system and anti-pathogenic function and anti-inflammatory functions. Vitamin A. Vitamin A was once known as the anti-infection vitamin. So far we've hit N-acetylcysteine, vitamin D, and vitamin A, which in the beginning of April is what I said is probably a great core for foundational health. So vitamin A was the anti-infective vitamin, and a vitamin A status is major in determinant of overall immune status. Those deficient in vitamin A experience impaired antibody response, decreased level of T helper cells. T helper cells are Th cells, so that's your Th1 cells. We lose our mucosal lining of the gastrointestinal tract as well as our respiratory tract. We need our antibodies to be robust so that we can remember what we've come in contact with and we can go after it. Unfortunately, vitamin A deficiency is common in the US, as 34% of adults consuming less than the expected daily rate. And while beta carotene is commonly considered synonymous with vitamin A, this is an error with significant clinical consequences, especially for vegans. Emerging research has shown multiple surprisingly common genomic variations, impaired conversion of beta carotene to vitamin A by 24 to 57%. What does that mean? Many of us don't have the gene to convert our carrots into vitamin A. That's what that slide means. So 34% of adults are low. And if you have had significant symptoms from an infection, there's a higher probability that your vitamin A is low. Vitamin A levels drop during various types of infection. Multiple studies have shown vitamin A supplementation improve resistance and recovery rate. So for adults, toxicity is typically seen after 100,000 IUs for 6 months. Many of us are recommending now 25,000 IUs a day as preventative foundational health. Multiple studies have shown that vitamin A deficiencies increase inflammation, and more limited research has shown supplementation decreases the inflammation. Zinc, many of us have heard about the zinc in the COVID era, but zinc is critical in tick-borne illness as well. Vitamin C. Vitamin C is ubiquitous in the discussion of the immune system. Vitamin C is recognized an essential nutrient in many aspects of the immune system. I know people have been doing vitamin C IV. We have had many a patient do IV vitamin C to support their immune system after they have been infected with tick-borne illness. And so we don't use it as a treatment, but we do use it as a support to the immune system. Vitamin C deficiency contributes to decreased immune response and increases the susceptibility to infection. So again, baseline, it would be nice if we had healthy D, A, and vitamin C, because it is shown to decrease our susceptibility of getting infected. So health of the host is incredibly important. And health of the host prior to COVID or health of the host prior to tick-borne illness. I'm a little concerned, as Bill mentioned, we're in tick season now, and we're also in prime COVID season, and we don't want the double whammy. And the best way to prevent getting seriously injured from this is to be healthy before we get it. Vitamin C supplementation has been shown to both prevent, treat respiratory and systemic infections. Vitamin C plays a critical role in supporting our borders. In light of the coagulopathy found in COVID-19 patients, again, replace COVID-19 with Lyme patients. This seems to be highly relevant. Vitamin C is highly relevant in this clotting factors for these diseases. There's a possible decrease in mortality in 167 patients with sepsis. So that's any kind of infection. And now they're showing in New York, there are multiple anecdotal reports of use of IV vitamin C. Those receiving IV vitamin C appear to be doing significantly better than those not receiving it. It's important to also know that zinc has to get into the cell. So you can't see me, but if you think of a cell, the virus has to penetrate the cell wall and then it replicates. So what the virus doesn't have its own copy machine, but our cells do. So the virus will get into our cells, hijack our copy machine, and make more of itself. And what zinc does is zinc doesn't allow that copy machine to get hijacked. And so what is incredibly beneficial is to get zinc on the inside of the cell. Well, one of the properties of hydroxychloroquine or Plaquenil is it opens up the zinc channel. This is called a zinc ionophore, but the zinc channel is opened by Plaquenil, and that's one of the reasons Plaquenil was thought to be very important. It's also another reason that Plaquenil is very important in tick-borne illness patients. You see the parallels right there. This is particularly relevant in chloroquine. Now, Plaquenil is hydroxychloroquine, but it's the commonly available flavonoid quercetin. Quercetin, which is, we use quite a bit. It's used for allergies and asthma a lot of times, but quercetin also does this. So simple things we can do to take health a little bit more proactive. SPMs are a piece of fish oil, and this is just showing that fish oil helps to reduce the inflammatory piece of disease, and also causes neuroprotectins in our body. Th1 support, I'm going to kind of fly through these so we can get to some questions, but things that will support Th1, I threw a bunch of herbs up in here. Berberine, bicalin, licorice root, echinacea, astragalus. That's their mechanism of action. Anti-inflammatory support, things like turmeric, bromelain, resveratrol, quercetin, melatonin, boswellia, and sulforaphane. So we come back to our picture here, and what we want to see here is addressing sleep, stress, and diet and movement. There are foundational support. The foundational support, as you see the top arrow there, is all the way through. Think of vitamin D, vitamin A, zinc, vitamin C, N-acetylcysteine or glutathione. Those are two things that are extremely important to support with the very first piece of prevention, whether it be tick-borne illness or COVID-19. Returning back to our picture here, which is differentiating the immune system. So when people say, I have chronic illness in I have immune dysregulation, what does that mean? Think of it as I'm shifted away from Th1 and natural killer cells to the other side of the picture, Th2 and Th17. Do I want to be there? No, because Th2 and Th17 shifts can lead to things like asthma and allergies and upper respiratory tract infections and urinary tract infections. But it also can lead to autoimmune disease and cancer and mood disorders and heart disease. So we want to shift our immune system towards either being completely regulated in the middle there or towards a Th1 natural killer cell support. And we've gone over some strategies to do that. These are the takeaways. I would be ecstatic if the Lyme community walked into their clinicians and said, I know I need to kill this, so maybe I do need the antibiotics and the killers, but what am I going to do to shift my immune system to Th1 and support my natural killer cells? What am I going to do? How am I going to change my diet, my stress, my sleep so that I can promote my Th1 side of my immune system? I know that's a lofty goal, but that's what I would wish for all the Lyme community to comprehend. What am I doing on a daily basis to support my Th1 and inhibit my Th17? That Th17 promotion is what chronic Lyme disease is. It's the inability to quell or quiescent a flare-up. It's the inability to fight something off. And we had a question earlier, even before we started, Bill gave me a question. Upon an injury, can that trigger a flare? Well, injury drives inflammation, and inflammation by definition detracts from our immune system support. So yes, any kind of trauma from a poor night's sleep can trigger a Lyme flare, and an injury or a trauma can trigger a Lyme flare. That's just understanding of this picture. If we can understand this picture, we can hopefully attenuate risk factors that go on every day in our life. So again, we want to shift over to Th1 and natural killer cell support so we can fight the infection that will always be within us. So we want to support the hand of health. I would ask those participants to critically analyze how and when they eat, how and when they sleep, how and when they move, what they're doing to support how and when they sleep, how and when they eat, and how and when they move. What are they doing to support immune regulation and stability? What are they doing to support Th1 support and natural killer cell support? And then once we've done all that, now what medications would be crucial for me to quell or quiescent an active infection? So that's what I got, Bill. I'll turn it back over to you. We'll take some questions.
All right. Well, thanks a lot. And we do have a number of questions.
Okay.
Some of these came in beforehand, and some of these came in tonight. So I will try to. I think we could possibly get through them all, but we'll see how it goes.
Okay, we'll see.
I've got several questions on this. Can people get a copy of these slides? I've told people that we are going to be saving this presentation and uploading it to our YouTube channel. So that might satisfy some people, but is it possible to get a copy of your slides, I guess?
Absolutely. I'm a big fan of health is not proprietary. So
okay, great. All right, so we'll work out the logistics of how to do that. I could possibly save it as a PDF on our Facebook page or something like that. Whoever's interested can let me know. You all have either have my email, or at least you know how to get to PA Lyme's Facebook page. So that is question number one. Question number two is one we got to you ahead of time, and it's one I'd like to hear the answer to.
Okay.
When there is a vaccine for COVID-19, should those of us that are affected with chronic Lyme, should we get that vaccine?
Well, so the question you have to ask yourself, and Bill, I don't know how to get back onto I don't know what can they see you or me? I don't know what we can see.
Let me see what we're seeing. I think we're still seeing your slides.
Yeah. Oh, you're still seeing my slides, not my screen?
I'm seeing, yeah, looks like, yeah. Can you stop sharing your screen maybe?
Maybe that's what I need. Oh, yeah. Stop share. Okay, there we go. Okay, that's what I was looking for.
There we go.
Okay. So yes, should we get the vaccine? That I'm going to say this to walk the fence a little bit. Everybody needs to make the decision for themselves as to what they should and shouldn't do when this comes out. I think it's important. First of all, let me say that to have a safe and effective vaccine anytime soon is highly, highly unlikely. I was in communication with someone from NIH. They don't feel that it's likely. We've never had a vaccine against a coronavirus. We've tried for SARS-1 for 18 years. So it's highly unlikely. A vaccine by its very nature is taxing to the immune system. So I would answer that question non-committally like this. If you are going to get the vaccine when it comes out, you better be in the best health you can be. You better be optimizing your vitamin D. You better be optimizing your vitamin A, your glutathione levels. Your diet should be optimal. And you are, by definition, at risk for a vaccine reaction if you are a Lyme disease sufferer. CDC says nobody who is sick, actively sick, should get a vaccine. Even the children should not get a vaccine if they're sick. So you have to be in good health to get the vaccine. So you have to ask yourself where you're at in the stage of your Lyme disease. No, I don't want to be misconstrued as telling people to not get the vaccine or to get the vaccine. I think the question is a personal question that needs to be answered by every individual and outweigh the risk benefits of it. Just know that you are in a higher risk category for a vaccine reaction because you have Lyme disease.
Fair enough. Thank you. Okay, next question is about zinc.
Okay.
Does zinc interfere with thyroid medications?
So thyroid medications are supposed to be taken on an empty stomach anyway to make their absorption steady. It will vary if there's anything in the body. Zinc is essential for thyroid function, but it's not going to interfere with your thyroid medication.
Okay, next question. What would be the cause of immune dysfunction since early childhood? Someone was told by their PCP decades ago that it's just bad luck. So someone's had immune dysfunction their whole life, I guess.
Well, I would say that luck doesn't have much to play with it. I think if you're seven, I try to use many analogies, but I wouldn't call it luck. I would say that something has driven your immune system into compromise. So there's different types of immune compromise. Some people can't make antibodies. They have low immunoglobulins. Some people are immune deficient. Those are factors that we're dealt that we need to manage. I don't think it's just bad luck. It's understanding our physiology and what can be done about it. So I don't really know how to answer that other than I think it's I personally take offense to it was bad luck. I would say, what is your physiology and how can I maximize it? What's the mechanism of your immune dysfunction and what can we do to regulate it?
Okay, very good. This question is about Plaquenil. Can someone with that's been diagnosed with Lyme disease get a prescription for Plaquenil?
So that's between you and your prescribing physician. So I do need to say that no doctor-patient relationship has been formed during this.
Of course, yes.
But the answer is absolutely. Absolutely, a Lyme disease patient can get a prescription for Plaquenil. It's an off-label use. My understanding, I don't want to quote him, but this is what was told to me. Dr. Horowitz puts every single Lyme disease patient on Plaquenil. So to say that it's used ubiquitous in the Lyme world would be an overstatement, but it is highly prescribed for Lyme patients.
Okay, next question. I have heard not all supplements are created equally. How do we determine which are the best quality supplements?
That's a great question. So there are quality companies. There's a handful of good quality companies. Unfortunately, most of them are through practitioner only lines, but what you can look for are the supplements third-party assayed. What that means is the supplement company sent it out to an independent laboratory. That laboratory tested it independent of the supplement company and gets that information back. It's called a batch test. So they'll send a piece of the batch they made out to a third party, and that third party assays it. And it is truly a buyer beware world in supplementation. So stick with brands that you trust or a physician that you trust that buys quality supplements. They're not all equal.
Okay, another question. Aside from sleep, stress, diet, would it be advisable to provide any of the other foundation supplements for kids? Vitamin D, vitamin C, zinc, etc.
So it's important to know that vitamin D and vitamin A, vitamin E and vitamin K are your fat soluble vitamins. So they can build up in the body. I think it is imperative that even children know their levels. And in the blind, which means you don't know your levels, it's usually safe, there's always exceptions, to supplement with lower levels of vitamin A and vitamin D. As you saw in the research that was presented, toxicity is greater than many, many months at greater than 100,000 IUs. So lower doses of vitamin A 2,000 IUs of vitamin D, as many as 10,000 IUs of vitamin A seem to be safe for most children. Journal of Pediatrics at one time recommended dosing newborns born in the north, which is where we are, 1,000 IUs of vitamin D upon birth. Vitamin C and B vitamins are water soluble. So most of the negative side effects of too much vitamin C is you'll get loose stools and diarrhea. So your water soluble ones tend to be a lot safer, but I think it's critical that all human beings support their immune system, which would include vitamin A and vitamin D.
Okay, I'm trying to go out to Facebook to see if there's any more Facebook comments. Every time I do, I tend to break up, so please bear with me just for a second.
Okay.
I think before I do that, I'm going to answer an off-topic question. We got a question about an update on some legislation that's in the Pennsylvania Senate Banking and Insurance Commission, HB 629. It's legislation about coverage for Lyme disease treatment. Somebody had sent in a question asking about the status of that bill. Why is it still sitting in the Banking Insurance Commission? Why is it not coming out for a vote? So I will, in a minute or two, try to help to answer that question. For starters, everything is delayed. Everything except legislation that's directed at COVID-19 is delayed at this point. So this is nothing different. We had gotten assurances from Senator Scavello that by June he would bring out that legislation, HB 629. He would bring it out to vote in his committee and then bring it out for a vote on the Senate floor. So it's still possible that he'll make good on that, or it's possible that because of this COVID-19 situation, it's delayed. So that's the best I can tell you right now. It is unfortunate that not much has been happening with that legislation. Let's see, more questions. Can mast cell disorder be reversed?
Yeah, so mast cell disorder, it's important to understand what is your mechanism of mast cell. So mast cell is a result of something else going on. So mast cell disorder can be reversed. Mast cells are driven by either infection or tissue debris, or so injury or infection is what drives a mast cell. So if we can isolate the cause of that, and then the inflammation begets inflammation begets inflammation. So that's a long answer, but the short answer is yes, you can reverse mast cell activation.
So I know you'd mentioned intermittent fasting.
Right.
So someone is asking what is your opinion on intermittent fasting? And I think you said it can be helpful. So could you elaborate on that?
Sure. So intermittent fasting can be helpful for several reasons. One is if you're ingesting food or dietary peptides that are inflammatory, you're giving your body a break from the inflammation. Two is your body goes into rest and repair mode when it doesn't have to go into the work on the digestion of the food. The fasting states also promote tissue repair. So there's quite a bit of research coming out. When you fast, you're going to drive certain pathways in your body that drive tissue repair. Now, this is knowing the physiology of the patient. So I never make a blanket statement. Everybody should intermittent fast, but I think if you don't have hypoglycemia, if you're able to tolerate it, you can put your toe in the water with a fast by doing a few hours and turning a few hours into a few more hours to where you can get up to like most of the day. Maybe you do what's called a 16-8 fast. So you do 8 hours of eating with 16 hours. You can work through that. Many patients will do a 24-hour or a 2-day fast. There's an awful lot of historical data for like 40-day fasts. In most religions and cultures, we've had a lot of fasts. It's typically in a healthy person very tolerable to do a several day fast, but intermittent fasting is by definition several days a month you fast, and time restricted feeding, which most people call intermittent fasting, is when you don't eat for a period of time throughout the day. And I think it can be very helpful for many, many patients.
Someone is asking your opinion on the keto diet.
Well, again, it's very individual. So a ketogenic diet was first done at Johns Hopkins University for intractable seizure patients in pediatrics. So kids were having seizures. They were not able to calm it down with any kind of medication. They put them on a high-fat ketogenic diet. So the brains were working on ketones as opposed to sugar. When the brain runs on ketones, it's low inflammation. When it runs on sugar, it's higher inflammation. So I think a ketogenic diet can be helpful. I think it's important to know some basic physiology before you go into a ketogenic diet, because nothing is good for everybody. So work with a physician who can run some basic labs on you and give you some guidance. But I don't think a ketogenic diet is bad, no.
Okay, this question sounds pretty specific to this patient, but I'm going to ask you, do you ever have patients who get a buzzing sensation in the chest, which is related to Lyme and not cardiac? If so, what do you do?
So I can answer the first part. The second part is harder.
Yeah.
What to do is based on what's going on, but absolutely we hear that internal buzzing or internal trembling. And so often they've had a full-blown cardiac workup with a Holter monitor and a King of Hearts where they've checked their heart. And it's not the heart. It's an internal sensation that they feel that it's very hard for them to describe and put their finger on. Absolutely, we've seen that. And then it depends on what's the mechanism for that.
Very good. I asked you this question beforehand. We have the time, so I'll go ahead and ask you now. Somebody that has, as far as they can tell, recovered from Lyme. They have no symptoms of Lyme left. Are still having 2 reactive bands on the Western blot, bands 23 and 41. So the question they have is, does that mean they still have Lyme? Does that mean they had Lyme in the past? What does it mean at this point?
So let me kind of break this down. There's 2 antibodies 2 categories of immunoglobulins we typically look for, IgMs and IgGs. So IgM is your medium range immunoglobulins, which means they'll come after a couple days and last up to 3 months at times, and then they tend to go away in classic immunological literature. IgGs are called your memory B cells. They're there after, they come a little bit later, and they have memory. It's also called a titer. It's what your body makes that you can always have a surveillance army against that infection. Classic one that I point to is when you got chickenpox, you developed titers, which are IgG antibodies, and you can keep those for life, and they will help keep your chickenpox at bay. And then if we run a titer, we can see you still have these IgG antibodies. What does that mean for Lyme? Well, it means if you've had Lyme and you're in recovery, we might run your Western blot, see positive IgGs in the absence of active disease, not the absence of disease, but the absence of active disease, which means you have it at bay. IgM is a little trickier because IgMs come out when things are more active. So if you have IgG antibodies to a band, it means you have likely seen, there's exceptions with what they call polyreactivity, but if you have an IgG band, you've seen that piece of Lyme disease before. So at the very least, we can say you have seen it. It doesn't mean it's active in you. It doesn't mean that it's a flare-up. It means you've very likely seen Lyme disease before. It's been in your body. Does that, Bill, I'll bounce that off you. Does that make sense to you?
Sure. Yeah.
Okay.
Yeah, that makes
I
good
can
sense.
go deeper. I just don't want to go into an immunological diatribe if it doesn't make sense.
No, I think that's good. That's a tough one, and that's a good answer. Is there a recommended supplement to help with sleep, specifically falling asleep as opposed to staying asleep?
Well, I can say what's been helpful for many people, very cursory. Falling asleep, you can think of something like melatonin. Melatonin has been helpful for many patients for falling asleep. Excuse me, if falling asleep is and staying asleep are difficult, some people use something simple like 5-HTP. Some people use theanine, GABA, but start simple. Melatonin drives Th1, which is what we want to do anyway. So since we're on a Lyme talk and we're talking about lack of sleep, I would say, maybe the mechanism is a lack of Th1. I would think melatonin makes a lot of sense.
Okay, here's a question. Very, what can I say? It's probably take a long time to be exhaustive on this question, but what is considered good for detox?
Well, I'll start very simple. To detox, you need a healthy liver and you need glutathione. You're not going to have healthy detox without glutathione and N-acetylcysteine. Again, if we go back to core foundational principles, the glutathione and the NAC is super critical. Another piece that's very important in detox is not retoxifying. So a clean diet, a healthy diet, a diet that is plenty of water. I'm hitting just the highlights. That we could do a weekend on a detox, but it's very important to support your methylation pathways. So some B vitamins, your cruciferous vegetables, which are Brussels sprouts, broccoli, cauliflower, and cabbage. So methylation, sulfation, glucuronidation, these are the pathways that you detox through in your liver. So it's important to mobilize your glutathione and some healthy sulfur vegetables, which would be helpful. Not retoxify. So it's hard to get clean clothes when you wash with dirty water. So don't keep putting garbage in your body. And after that, there's a million different detoxification shakes and diets and makers. There's all kinds of different things to do. But I would say if you're doing your NAC or glutathione, eating a healthy diet with good cruciferous vegetables and sulfur vegetables, you're probably well ahead of the game.
Okay, we got a follow-up question about sleep. Somebody that wakes up at 3 a.m.
So that's able to go to sleep and not stay asleep.
Right.
So there's a couple mechanisms for that. A key mechanism for that is if your blood sugar drops. So if your cortisol levels go up, if your stress physiology is high. So cortisol is very low when we go to bed and allows us to sleep. Think cortisol Th2, right? Stress Th2. So if our blood sugar goes down, our cortisol is going to go up. If our stress physiology is up, we're not going to be able to sleep. So not being able to stay asleep, again, we want to know the mechanism, but you can also look to things like GABA support, things that are calming. Many people have done well with cannabinoids, so CBD oils have been helpful for sleep because it helps reduce that. And then making sure your blood sugar doesn't drop. So if you're one of those people that's doing a 24-hour fast and your blood sugar goes too low, you're not going to sleep.
Exactly. Yep. Okay, I have a question here about the C4A test. Can you explain what a complement C4A test determines and what does it mean if it's high?
Sure. So complement factor, C4A, if we think of its name, it's complementing the immune system. So when the immune system says, hey, I need a little bit of help, there's C4A, there's C3A. These are fragments of complement factor. So C4A elevated. By the way, complement factor is made up of cysteine, which comes from N-acetylcysteine. So the complement is complementing the immune response. So if you have a Th1 cell or a natural killer cell or a macrophage or neutrophil, which are types of white blood cells, when they go to work, they're going to send out a signal that says, hey, I need some help. That is something that is complementing the immune system. So C4A is one of the steps in complement factor that is indicative of the immune system being active. It's not specific to Lyme. I know a lot of people will say C3A is specific to mold and C4A is specific to Lyme. Nothing could be further from the truth. It is what it is. It is complementing the immune system. So an elevated C4A means your immune system is activated. That's all it means. But it's important.
Okay, we have a COVID question.
Okay.
What is your opinion on wearing masks for COVID prevention?
So it's a great question, and there is a tremendous amount of controversy on this. So I happen to have 2 masks on my desk, and I'm going to be I'm going to keep my opinion out of it. This is an N95 mask, and this is a surgical mask. An N95 mask protects you against the virus entering into your lungs. That's what an N95 mask does. So an N95 mask helps to protect you. A surgical mask gets its name because surgeons wear it. It doesn't protect the surgeon. It protects the patient on the operating table. A surgical mask protects those around you. It's not worn for your protection. It's worn for others' protection. Now, when should this be worn? I think we should all agree, if you're going into a retirement community, a high-risk community, a community where people are at risk, it would be polite and respectful to wear a mask. And to say that these don't do anything, all you have to do is sneeze with one over your face and then sneeze with one not over your face. You're going to spew spit if you don't have this over your face. Now, should we all get infected is another conversation, but we should certainly be protecting those at risk. So I think those at risk, when you're around high risk people, I think it would be polite and respectful and prudent to wear a mask. If you're worried about getting sick yourself, this surgical mask isn't going to help you. If you're worried about getting sick and you feel you're high risk and you're out in public, you need an N95 mask. Now, I'm going to leave a lot of my thoughts on the side on that one, but I think that just to know what the 2 types of masks do. One protects you, one is protecting others. The one that protects others is like covering your mouth when you cough, just at a better rate.
Very good. We have a lot of questions. I don't know that we're going to get to them all. Let me try to just pick
Okay.
off maybe a couple more. Question about the MTHFR genetic disposition. If you have that, what would you recommend for detox at that point?
Well, if you have the MTHFR, there's many genes associated with that. It means you have not the norm of methylation, and methylation is a biological process that can help promote detoxification as well as reduce inflammation in the body. And it would be, for most people with methylation defects, they're going to need methylation support. What does that mean? It comes a lot of times from their methylated B vitamins. So if they are supplementing with like folic acid or B12, it should say methyl in front of it. So those are methylated folate, methylcobalamin. So if you have the methylation genetic alteration, I don't like the word defect because that just makes this unique, but if you have the methylation gene or a couple of them, you're going to need to support that pathway a little bit more. And you're probably, blanket statement, there's always exceptions, going to need some methyl donors, which typically come from your B vitamins.
Okay, is raw sauerkraut good for you?
Raw sauerkraut. Well, raw sauerkraut does a couple things. Raw sauerkraut is fermented. So the way that it ferments is, most of us are familiar with, you put cider in the fridge too long and it starts to bubble, it ferments. That's because there's live bacteria and probiotics in it. So raw sauerkraut is a natural probiotic. It's naturally occurring probiotic. It's also the reason a lot of the probiotics like it so much, large surface area. It's good for digestion. It's bad if you have something called SIBO, because now you have too much bacteria in your digestive system, but it's an excellent, excellent natural probiotic.
Okay, very good. I think I'm going to cut off the questions there. Let me
Okay.
share my screen again.
Okay.
Can you see my screen, Dr. Turnpaugh?
I can.
Okay. Okay, so we just finished up the Q&A. And in closing, I just want to thank you, Dr. Turnpaugh, for your time. It's been very, very helpful. Go ahead.
I was going to say, it's my pleasure. You know, myself and my office, we have family history of severe Lyme disease. It's something near and dear to our hearts. And we are in this with your community. We're part of the community. We're not just on the outside talking in, we're on the inside as well. So we've been a friend to Lyme disease for an extremely long period of time. And we hope to continue to partner up with PA Lyme, anything we can do. So it's a pleasure for me to be here.
Well, thank you very much. So this was session number 1 in our PA Lyme virtual webcast series. Coming up 2 weeks from today, May 26th, Tuesday, May 26th, 7 to 8:30 p.m., we're going to have Dr. Joseph Burrascano. I'm sure he needs no introduction. He is a pioneer in Lyme and tick-borne diseases, someone I'm very much looking forward to hearing. And just like we did for this seminar, you can email your questions ahead of time to me. We'll have the same setup. We'll have people allowed to register for the Zoom webinar, and those that can't reach us by Zoom will be live casting to Facebook. Finally, when we're done with this presentation tonight, we are going to upload it to our YouTube channel, and it'll stay on Facebook for some period of time, but it will be on our YouTube channel and our website, www.palyme.org. So please, if you enjoyed tonight's session and you know others that could benefit from it, please, in a couple of days, check our website, check our YouTube channel, and we will have this presentation. I will get the slides from Dr. Turnpaugh and figure out a way to share them with you. Most likely, I'll post them to our Facebook page. Or if anybody needs them by email, I'm happy to email them as well. And then that's May 26th. We're going to have Dr. Burrascano on June the 9th, Tuesday, June the 9th, 7 to 8:30. We're going to have Rita Rhodes, who's also a very good friend of to PA Lyme and someone that's treated a lot of Lyme patients. She will be speaking as well. We'll have more about their topics coming up. In May, mid-May, well, it is mid-May, within a week, I'll say, we're going to have a PA Lyme newsletter coming out. It will have, I tried to give you a brief update on HB 629. It'll have a little bit more expansive update, as well as some things for May, which is Lyme Disease Awareness Month. So look for that coming out in the next week or so. And if you've not been seeing them on our Facebook page, we have almost daily, I'd say every couple of days, we're putting out a new prevention tip on our Facebook page. So keep looking out for those. And those are good to share on Facebook. Share them to your personal timeline. Share them with your friends. Again, everybody's fixated on COVID, coronavirus prevention. Not as many people are thinking about preventing Lyme disease, but they definitely need to be thinking about it because a very high risk, terrible winter for killing ticks. I'm sure there's more ticks this year than there were last year. So we're at risk. The ticks are active. So now's the time to be thinking about prevention. And I'm going to check the Q&A just one more time. Oh, it's just mostly a bunch of thank yous. And thank you, everybody that joined us. I appreciate everybody that joined us tonight. And we will, somebody tell me again that I'm breaking up. So I will email you this presentation if you email me and tell me that you want me to email it to you. So with that being said, I think we will call it a night. Thank you again, Dr. Turnpaugh, and thank you everybody for being with us.
Thank you.
Okay, good night.